Hello, I'm Garvin. Welcome to our new telehealth video series. In this video, I'll give a brief overview of what you need to know about ADHD. In particular, I will cover what ADHD is, how you treat ADHD, and how you can live with ADHD. So first of all, what is ADHD? So attention deficit hyperactivity disorder is a chronic condition that affects millions of children and often persists into adulthood. Problems associated with ADHD include inattention and hyperactive, impulsive behaviour. Children with ADHD may struggle with low self-esteem, troubled relationships and poor performance in school. While treatment won't cure ADHD, it can help a great deal with symptoms. Treatment typically involves psychological counselling, medications or both. In most children diagnosed with ADHD, signs and symptoms appear before the age of 7. In some children, signs of ADHD are noticeable as early as infancy. So the signs and symptoms of ADHD include often fails to pay close attention to details or makes careless mistakes in schoolwork or other activities, often has trouble sustaining attention during tasks or play, seems not to listen even when spoken to directly, has difficulty following through on instructions and often fails to finish schoolwork, chores or other tasks, often has problems organising tasks or activities, avoids or dislikes tasks that require sustained mental effort, such as schoolwork or homework, frequently loses needed items such as books, pencils, toys or tools, and can be easily distracted and often forgetful. So you may suspect your child's behaviour is caused by ADHD if you notice consistently inattentive or hyperactive impulsive behaviour that lasts more than 6 months, occurs in more than just one setting, typically at home and at school, regularly disrupts school, play and other daily activities, causes problems in relationships with adults and other children. So how do you treat ADHD? Standard treatments for ADHD in children include medication and counselling. Other treatments to ease ADHD symptoms include special accommodation in the classroom and family and community support. So the medications currently will be stimulant drugs and non-stimulant medication. So atomoxetine or Stratata are most commonly prescribed medications for treating ADHD. Stimulant medicines for ADHD include methylphenidate, which is Ritalin or Concerta, dextroamphetamine, which is an amphetamine, and lisdexamfetamine dimacetyl or Tyvence, which is the brand name. Although scientists don't understand exactly why these drugs work, stimulants appear to boost and balance levels of the brain chemicals called neurotransmitters. These ADHD medications help improve the core signs and symptoms of inattention, impulsivity and hyperactivity, sometimes dramatically. However, effects of the drug wear off quickly. Additionally, the right dose varies from child to child, so it may take some time in the beginning to find the correct dose. ADHD counselling and therapy. Children with ADHD often benefit from counselling or behavioural therapy. Some children with ADHD may also have other conditions such as anxiety disorder or depression. In these cases, counselling can help both ADHD and the coexisting problem. So how best to live with ADHD? Because ADHD is a complex disorder and each person with ADHD is unique, it's hard to make recommendations that are right for every child, but some of the following suggestions may help. So show your child lots of affection. Children need to hear that they're loved and appreciated. Focusing only on the negative aspects of your child's behaviour can harm your relationship with them or her and affect self-confidence and self-esteem. If your child has a hard time accepting verbal signs of affection, a smile, a pat on the shoulder or a hug can show you care. Look for behaviours for which you can compliment your child regularly. Next would be patient. Try and remain patient and calm when dealing with your child. Keep things in perspective. Be realistic in your expectations for improvement. and also take time to enjoy your child. Make an effort to accept and appreciate the parts of your child's personality that aren't so difficult. And try to keep a regular schedule for meals, naps and bedtime. Make sure your child is rested. Identify difficult situations. Try to avoid situations that are difficult for your child. So that brings this video to an end. If you want a more detailed explanation of ADHD, you can book a brand new service we are now offering where we co-create a cohesive health management plan and where we help you to better understand your condition and take an active role in managing it with confidence. So call into Lynch's Pharmacy in Douglas and Cork or call 021 436 6923 to book your telehealth clinic for ADHD today. Thank you for watching. Stay healthy and stay informed.